Achilles tendonitis can be the Achilles heel for many athletes, hampering their performance and progress. But it can also affect everyday people if it's under too much stress. So what can you do about it? Stay tuned to find out. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I'll give you 3 methods to treat your Achilles tendonitis to help you get back to normal, functional, pain-free movement. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. Achilles tendonitis, also known as tendonopathy, is an inflammation of the connective tissue or tendon between the calf muscle and the heel bone of the foot, generally caused by overuse or weakness of the muscles of the lower leg. This condition can affect mobility of the ankle joint, cause pain and swelling around the Achilles tendon, and can prevent you from doing high impact or explosive activities. So I'm going to provide 3 methods of treatment that can help rehabilitate the condition and get you back on your feet, pardon the pun. The first is a self-massage technique, the second is an eccentric exercise, and the third is stretching. So let's go through each one in turn. The first treatment is self-massage. With your foot relaxed and your lower leg supported, use your thumb and forefinger to pinch the belly of the Achilles tendon gently and then rub forwards and backwards, working across the fibres. The action will promote blood flow to the area without stressing it, to aid with the healing, and ideally do this for a few minutes, ensuring that the pain doesn't increase. You can gradually increase the pressure of your pinch if needed and work your way up and down that small area of the tendon, but make sure you stick to pinching either side of it and not to put pressure on the back. An eccentric exercise is loading the muscle in its shortened state and then slowly lengthening it under that load. A simple example of an eccentric contraction is as you lower a weight with the arm, the bicep muscle is contracting but also lengthening with the movement. This form of training is beneficial for strength and rehabilitation, and 70% of people using this method will find that they can return to normal sports and activities after 3 months. For the Achilles tendon, we need to work the calf muscles eccentrically. We can build this up in stages, so initially start with both feet flat on the floor near a support for your balance, and with your legs straight at the knees. Lean your weight towards your non-affected side, marked here with a black sock, and lift the heels off the ground. At the top, transfer your weight across to your affected side, marked here with a red sock, and then lower your heels slowly back down to the ground, contracting eccentrically under the load of your body weight. Repeat this movement until you have done 15 repetitions, and then after a minute rest, you can do a further second or third set. Aim to do this twice a day, and you should work within 40% of your pain threshold, but when they start to get easier and you feel that you don't need your other leg as a support, then you can move on to the next stage. A variation of this exercise is to do it with the knees bent. The movement around the ankle is exactly the same, as is your transfer of weight from one foot to the other, but your knees remain fixed in this bent position. This targets the soleus muscle rather than the gastrocnemius muscle, so it works the calves in a slightly different way. It's worth trying this version to see if you gain any benefit from it, and you can also do both versions to help build up strength in the lower leg muscles more effectively. For stage 2, you can progress to single leg eccentric exercises. So this time, start in the same setup as you did on stage 1. However, when you reach the top with the heels off the ground, you're going to take your good side foot off the floor, so your affected side takes all the weight before slowly lowering it back down. As with stage 1, repeat for 15 repetitions, and you can do 2 to 3 sets and perform them twice a day and still work within your 40% of your pain threshold. As with stage 1, you can also perform this stage with the knees bent as a variation, so follow the same steps but just ensure your knees stay bent throughout the entire movement. For the final stage, we can increase the range of movement by performing the one leg exercise on the edge of a step. This time, start with the balls of your feet on the edge of a step, and again be close to a handrail or banister for balance purposes. You will perform the exercise in exactly the same way as you did in stage 2, but this time allow the heel to drop much lower, increasing the range of movement while under load. As with the other two stages, perform a set of 15 repetitions, 2 to 3 times, twice a day, working within 40% of your pain threshold. And again, as with the other two stages, you can also try this exercise doing it with the knees bent, taking care not to move the knee joint with the movement of the ankle. If you persevere with these, progressing through the stages as you go, then you should get some results after 12 weeks, which should allow you to return to normal activities. The final method of treatment is stretching, and although it may not be as effective in rehabilitating the tendonitis as the previous two methods, it will help you manage the pain as well as relax any muscle tension. As with the strength exercises, you can isolate both the gastrocnemius and the soleus muscles independently. So firstly, let's look at the gastrocnemius stretch. So the first one is probably the most popular and well known, where you place one foot in front of the other, resting your hands on a wall, ensuring that the toes of the back foot point straight forwards and the heel is pushed down into the floor. The back leg is the one being stretched, so make sure the knee of this leg stays straight. You will then gently move your hips towards the wall until you feel the stretch below the back of the knee. Hold the stretch for at least 30 seconds, and if the stretch feeling dissipates within that time, you can always move further into the stretch. An advanced variation for this stretch can be doing it on the edge of a step to allow more of your weight to transfer through the muscle. Let's now look at the soleus stretch. So like with the gastrocnemius stretch, start with one foot in front of the other, not too far apart, resting your hands on a wall. But this time the stretch will be on the front leg. So make sure the toes of the front foot point straight forwards and the heel needs to be pressed into the floor. This time, instead of focusing on moving your hips forwards, focus on bending the front knee towards the wall, whilst ensuring the heel stays flat on the floor with your weight through it. You'll feel the stretch lower down the calf muscle this time. As with the other stretch, hold for at least 30 seconds and move further into the stretch if you need to within this time. Like with the first stretch, there is an advanced variation where you can do the stretch with your foot on the edge of a step to drop the heel lower, increasing the intensity of the stretch. You can do these stretches as often as you like or whenever you feel stiff, which could be in the morning. Just be careful not to stretch a rested muscle, so move around a bit first to wake the muscle up. I hope you found this video useful today. If so, please give it a like by clicking the thumbs up button below and share this video with friends to help this channel grow so more people can benefit from it. And remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.